Hello, everybody. Thank you for joining Katie, Marguerite, and me, Briar Andresen, as we cover our current HIPAA landscape in an attempt to answer one of the questions that we most often get on HIPAA, which is, are we doing this right? The short answer is maybe not, but you've got a lot of company if you're not. And so we will get to all of that. Before we do, we've got a couple of housekeeping matters. One is that if you have questions as we're going along, please direct them to us via the chat function on your screen. You can get there by hovering over the bottom of the screen, and you will see both the chat and the Q&A feature. Please use the chat. That's the easiest way to get to us. Keep in mind that during the noon hour, there may be some internet audio cutout because it is so busy. So you can use the dial-in number provided if you're having an issue with that. A note about our next webinar. In December, we will be carrying on the traditional Fredrikson and Byron holiday series of discussing the fee schedule. So we'll talk about OPPS, IPPS, any other new Medicare rules that come out as part of that.
That'll be December 13th.
December 13th. And you can always watch this presentation on our YouTube page. That will be available in a couple of days for free. And I think our last issue is to please fill out the survey at the end of the presentation to let us know how we did, if we can do anything better, and if you've got any great suggestions for what you want to hear about in future webinars. And with that, I think we're ready to get started. Katie is going to lead us off.
Hi, everyone. Thanks, Briar. I'm Katie Ilten, and here's an overview of what we're going to talk about. We're going to spend a little bit of time at the beginning covering some stats and information that's pretty new from OCR on their enforcement numbers, and then Briar's going to talk about what we know about the HIPAA audits, and I think we're in, if not finishing up, phase 2, and so we have some information from there, and that hopefully will orient you as you think about kind of what the possibilities are for OCR enforcement and how to prioritize things at your organization. So I should say before we get in too far, OCR stands for Office for Civil Rights. That's the federal agency that's part of, I guess, the Division of Health and Human Services. And so OCR is the agency you hear from when something has gone wrong on the HIPAA front. Generally, OCR is enforcing HIPAA or ensuring compliance or trying to in a couple different ways. Probably the biggest effort is through investigating complaints that OCR receives, probably most of them from individuals who've been affected, whose PHI has been affected. They also initiate compliance reviews, and that usually happens following some sort of breach. As you know, covered entities and businesses, or covered entities need to report their breaches to OCR at least on an annual basis, and in the event of big breaches, right away. And so compliance reviews are often initiated after those. And then OCR does conduct education and outreach, and I think that's actually the umbrella under which they're conducting these audits that Briar is going to talk about. So before we move to audits, I wanted to kind of give you an idea of what the disposition of what an OCR investigation or a complaint that goes to OCR might look like. There are several different things that can happen. In fact, for many complaints that go to OCR, they resolve them pretty quickly by dismissing them or closing the case because they determine that they don't have jurisdiction over the entity that's complained about. So maybe, and I've actually seen this situation where a company used to be a covered entity but is no longer a covered entity, and they had a complaint about their covered entity days, and we were getting prepared to have to answer a lot of questions, and happily, when we informed OCR that the business was no longer a covered entity, they went away. So that was great. So that does happen. There are quite a few times when OCR decides that they're not going to investigate, they're just going to provide some sort of counseling or technical assistance to the entity. There are many times when OCR does do an investigation and they do come out saying there have been no violations. That's always a very happy letter to receive, and it does happen. When the investigation determines there has been a violation, there is some corrective action taken. In the vast majority of cases, the corrective action does not result in a settlement or resolution agreement. The covered entity is directed to take the corrective action, and they do, and then it's over. But in, I think, around 50 to 60 cases, we know of actual settlement agreements, at least the ones that are available to us publicly, that are out there, where there's been written agreement where the entity has said they will do certain things to be better. And also in those situations, there have been monetary amounts that have had to be paid. The fifth kind of disposition out there is the civil money penalty. There have not been very many cases where OCR has assessed a civil money penalty. Usually those where the OCR is threatening one, you end up settling under number 4. But there have been a couple cases, and that so far has been reserved for really, really bad conduct, like not responding to OCR inquiries after several attempts to by the agency to reach the covered entity, and then responding, but then being totally uncooperative in the investigation. So don't be like that. And then OCR does refer cases to DOJ or maybe a state agency. And actually, in preparing for this webinar, I found out that OCR tells us they have actually referred over 600 cases to DOJ for criminal investigation, which is way more than I thought. There haven't been really many criminal convictions, but I guess they're looking at that possibility more often than I knew. So I just realized these slides are a bit out of order, so I'm going to start here. Just to give you a sense of numbers, since 2003, I think this data that I have on these two slides is up to date, I think, through 2016. Since 2003, OCR says it's received over 165,000 complaints, and they've resolved nearly all of them. Happy to report that they determined over 100,000 were not eligible for enforcement, so complaints that didn't have anything to do with PHI or covered entities or something like that. A good chunk of the remaining 60,000 or so 23,000 were early intervention with technical assistance and no investigation. So it is true that OCR is out there, or at least was since 2003, helping people fix problems without launching a huge investigation. Let's go back to my next slide. Where there have been investigations, about 12,000 were determined that there were no violations, and so that actually does happen, so take heart. And then there's a big bucket, 25,000 or so, that were resolved by corrective action, but not necessarily all of them, and in fact most of them not with a settlement agreement, at least that we know about. And I think they have to publish settlement agreements. So of those 25,000, 52 or so, at least by my last count, had a resolution agreement with a monetary settlement. And those the settlement amounts are not for the faint of heart, totaling over 72 million. So the people who've had to pay have had to pay a lot, and be examples for all of us, I guess. And then, like I said before, just a few civil money penalty cases.
And if I could interject just one thing, as Katie says, those numbers are really significant, and they are not necessarily, aside from the civil monetary cases that she mentioned, they're not necessarily bad actors. In most of the cases that we've seen, they're sort of everyday things that just happen, human error in most of the cases. But those numbers can really add up when OCR decides they want to get their teeth into something.
And what they usually do, at least we've seen, is they start with the total possible civil money penalty arising out of a violation. And OCR is not chintzy when they're calculating the civil money penalty. They say, instead of one violation for not having a business associate agreement, it's one violation for every transmission of PHI that happened that wasn't covered by a business associate agreement. So when you multiply the potential dollar per violation amount times the number of violations, you reach a pretty high number. And then that's the starting point for OCR to begin negotiating the settlement amounts. And so that's one way in which they kind of get to these high numbers. So this is just, these next few slides have charts that are from our OCR on their enforcement data. And I will say the page, the OCR webpage has all of this, and it's quite interesting information to kind of go through. Strangely, don't be deceived by this diagram, because in fact the numbers are chronologically backward. So it looks like maybe the number of complaints received by calendar year has gone down, but if you look at the bottom, for some reason they started in the most recent year with data. And so actually how you should read this is that the number of complaints are going up dramatically. And so there are, more people know about HIPAA. There may be more people in the healthcare space doing HIPAA-related activity. Complaints are coming in, and OCR has a lot on its plate. The other area where OCR is trying to ensure compliance is by conducting compliance reviews. And usually this happens when there's been a breach, but not always. I don't actually know the rhyme or reason as to why a compliance review might begin, but certainly there haven't been as many of these. Their main, vehicle for getting investigation is through the complaint avenue. They've initiated 841 compliance reviews since the beginning of HIPAA. And just to give you a little idea of the disposition of those compliance reviews, where the compliance, at least in 2015, where the compliance reviews did not arise out of a breach situation, there was still, 67% or so big chunk where corrective action was obtained. So they're probably targeting cases where they think there's a violation. So they're a little biased that way. So if you're into a compliance review situation, you're probably less optimistic than they might come out with a disposition of no violation than if someone had lodged a complaint, then you're having to respond to questions about that complaint. And then where the compliance review comes out of an actual breach that's been reported, nearly all, 85%, at least in 2015, were closed after there was corrective action that was ordered. The OCR web page has some interesting information on the most common types of entities that are required to undertake the corrective action. I found this list really interesting. This was the order of, the order of the most common offenders, starting with private practitioner or physician practices. That's apparently still the biggest number of offenders, or the biggest type of offender group. Hospitals, and then outpatient facilities, pharmacies, and then health plans in fifth place. What the information didn't provide is kind of the remaining, where other types of facilities fall. What's glaringly missing from here, and always surprises me, is the long-term care, aging disability service provider industry. Just doesn't seem to be appearing very often on at least in terms of the violators and the people who are having to enter into corrective action. I don't know why, because I actually tend to think that industry seems to be a little bit behind in HIPAA compliance, so I'm not sure, why OCR isn't going there, or maybe they don't get as many complaints, but that's sort of an interesting, party or type of provider that isn't you're not commonly seeing them in HIPAA enforcement stories. And then the HHS Wall of Shame, or the OCR Wall of Shame, I actually did not start calling it Wall. Somebody else started calling it the Wall of Shame, and I think maybe I've even heard of OCR referring to it as the Wall of Shame. But this is the website, the page on OCR's website where they list all of the big data breaches over 500, affecting over 500 people. And I think I crunched these numbers probably a year and a half ago, so these probably changed a little bit, but surprisingly, even in the last year or two, still the most common location of PHI that was implicated in a breach is paper. So paper, that we're focused on electronic information and rightfully so, but don't forget about protecting your paper records. I also expect that the network server situation where you have PHI available out on the network with the continuing developing sophistication of ransomware and malware, that will be, that repository will be implicated more and more. This is just another breakdown, the types of breaches that are out there. And again, this is breaches affecting over 500 people. Theft is still, just outright theft is still the most common, or at least was as of a year ago. Again, I expect to see hacking and IT incidents increase as hackers' sophistication levels increase. Hand it over to Briar on audits.
Thank you, Katie. So the HIPAA audit program has been going on for some time, and the phase 2 audits have been happening since July of 2016. And what OCR said is that the phase 2 HIPAA audit program was supposed to review policies and procedures that had been adopted and employed by both covered entities and business associates to meet their selected standards and implementation specifications for privacy, security, and the breach notification rules. And so what they did is they requested information from covered entities and business associates. They reviewed policies and procedures, gathered a bunch of information via email. They said they were going to look at a broad spectrum of types of entities, but in fact 90% were healthcare providers. That kind of makes me wonder too about Katie's question about how are they really choosing who they're going to look at, and are health plans really causing fewer problems than other people? I'm not so sure, and I'm not so sure they were really looking for much in the way of health plan compliance. The majority of covered entities and business associates had a privacy and breach audit, and another third approximately had the security rule audit. Again, the OCR said that they were going to use the audit program to assess HIPAA compliance efforts. And what they said is that this would present an opportunity to examine mechanisms for compliance, identify best practices, discover risks and vulnerabilities that might not have otherwise come to light through their ongoing complaint investigations and compliance reviews. And what they said, again, is to enable OCR to get out in front of problems before they result in breaches. Their goal was to broadly identify best practices through the audit process and then provide guidance targeted to identified compliance challenges. I think that the upshot here is that the general audit findings are a pretty good indicator of where OCR is finding what they consider HIPAA problems and a likely view of what OCR is going to aim at if they're investigating you for some other type of breach or complaint. And it becomes a big issue because, as Katie said, they find these violations and they can add up to really significant penalties when they get calculated on a per person, per day basis, which is generally how they do it. And so when they're doing those reviews, if you get investigated because a patient complains about something that happened, they're going to ask for a bunch of information, and it's almost certainly going to include your risk analysis. And the initial complaint may have had nothing at all to do with your risk analysis, and OCR will jump all over it if you have one that they think is not good enough. So despite the fact that OCR has said that these are mostly a compliance improvement activity, a real opportunity for the covered entities that were audited to get this kind of free compliance review, they are going to use that information to determine what they're really looking at, both for guidance and for penalty assessment. They also have said they don't intend for these to be the same as a compliance review, but if an audit report indicates what they call a serious compliance issue, they may initiate a compliance review to further investigate. So that possibility is out there. So as part of their audit process, the covered entities were asked to identify their business associates. OCR encouraged covered entities to prepare a list of each business associate agreement with contact information in order to respond. And if I'm not mistaken, OCR decided that it was a failure if you didn't have a compiled list of business associates ready to go, and if your business associate agreements didn't have business associate contact information in them. Those requirements are nowhere in the rule, but that is what OCR found during their investigation. The audits were supposed to be, this phase 2 was supposed to be wrapped up by the end of 2016, followed by on-site audits in 2017. We'll talk a little bit more about that. They did say that some of the entities that went through the desk audit would also have an on-site audit. And again, they said it was possible that significant findings would lead to a separate compliance review from OCR, and that is, as Katie said, the bad kind of review. So the audits were supposed to start in the first quarter of 2017, but in fact, they might not be happening until 2018. OCR has said they're still assessing the results of these desk audits. In their preliminary review, though, they did find that out of their 166 covered entities, compliance was inadequate, and over 94% of covered entities failed to demonstrate appropriate risk management plans. And we'll get a little bit more to that in some upcoming slides. But as Katie talked about related to enforcement, given the findings, we should expect to see that there is going to be a focus on risk management problems that are addressed in future penalties, as there has been in the recent past as well. And again, the big problem is when there is a significant issue, and mostly that is when you have something really egregious, like a website that's been sitting open to the public and has PHI on it, or issues affecting lots of people. That's where those big numbers can start to add up for OCR, and when they really decide they're going to look at everything you've done to find all the problems that you've had. A little bit about the rating system that OCR used to assess compliance. They did it in what I think of as kind of a backwards way. A rating of 1 or 2 means that you have done a good job. 4 and 5 means that you've done a bad job. The keys here, if you get a 1, that means that you're in compliance with both the goals and objectives of HIPAA standards. And to me, that sort of says compliance with goals and objectives of the standards means you're actually going beyond what the regulations actually require. If you get a 2, to me that says you are in compliance. They've called it substantially meeting the criteria, having appropriate policies and procedures, and other evidence of implementation that meets the requirements. I think that would be great. Getting 2s would be great. A 3 in the middling area means you've only minimally addressed the audited requirements. You have made attempts to comply, but some of it's inadequate, or you perhaps have misunderstood the requirements. 4 and 5 are the bad ones. 4 is a negligible effort to comply, including, they specifically noted that you've maybe copied your information directly from an association template, or had evidence of poor training. That's poor training documentation and generic training. And a 5 is that you didn't make any serious attempt to comply. So given that, the failure rates I found very interesting. So this table is sort of a general compliance where inadequate or worse was something that was a 3, 4, or 5. There were really poor scores on giving patients the right of access to their PHI. The content of the notice of privacy practices, which I feel like has been a subject of hardly any guidance from OCR. The worst one was the security risk management plan and security risk analysis, and we will get to those. But from OCR, this little table is from OCR. It shows work to do, particularly in that risk analysis and risk management area. You'll notice that a 1 rating was achieved by 0 for the risk analysis, and one entity for risk management. So, you know, again, this notes that OCR is really focusing on these things and recognizing that there are problems with these things. And since they're recognizing it, covered entities should recognize it as well. Again, the notice of privacy practices content, the 2 and the 33%, those are the ones that have managed to comply. So we've got 35% compliance on that. I don't know, but suspect that a lot of those findings are entities that did not include state law provisions in their notice of privacy practices, that the state law that is more protective of patient information or provides greater access to patient information, that is supposed to be specifically included on your notice of privacy practices. And I think many entities don't do that and kind of go with the basic of what is there in the privacy rule and OCR does not think that is enough. On this slide, you can see I have used my graphic design abilities to make some specific notes for you. This is a patient's right of access to their own PHI. 11% did this correctly. That is not very good, and 65% were quite bad, having not complied really at all. So they haven't complied, that is, in a way that means they've made even negligible efforts. So that's a significant problem, and we'll talk a little bit more about what that right of access means and what OCR is expecting there. Again, risk analysis and risk management, really bad. I didn't even circle it because it's so tiny, but you can see there on the left-hand side, the security risk analysis has a 0 in the pie chart. Nobody complied with it in a way that met the goals and objectives. So apparently this is not easy to get right. So if OCR is serious about what they said are the goals of the audit program, this will lead to them actually providing some helpful guidance on how covered entities should handle these issues and comply with the risk analysis and risk management requirements. There is a ton of guidance, and I would say not all of it is super helpful. So as we wait for some helpful guidance, Katie is going to provide some useful information on what you can do now with the information that you actually have. So this is, Linda Sanchez is a senior advisor for health information privacy at OCR. She leads the health information privacy, security, and breach notification audit program that is mandated by HIPAA, by the HITECH Act rather, and she is also the OCR lead on health IT policy and coordinates the enforcement policy and outreach initiatives. And she gave a talk, and an audience member asked, so what's coming after phase 2? And as you may recall from a few slides ago, it's supposed to be on-site audits. Linda said, that's a very good question. I know the goals are for on-site audits. I believe that is what will come next. So I think we have no real guarantee that on-site audits are for sure happening, but we do know that there will be continued investigations based at least on reported breaches and complaints. So with that in mind, here is Katie again to talk about some security rule issues.
All right. So I'm going to spend several minutes here talking about security risk analysis and the risk management process. And as Briar said, there's guidance out there. There are a lot of documents out there on OCR's website. Not all of them are helpful. But what I want to give you are sort of building blocks, basics that you can take to your technical people to make sure that the technical evaluations you've done on the risk side of things, if you've done them, and if you have, that's great. A lot of people haven't, fit and look and are presented in the way that OCR seems to be wanting them to be organized. And I think that putting it in their language and in their format will go a long way when if you are ever investigated and they ask for your security risk analysis. And what's interesting is that I think in every OCR letter that we've seen investigating a complaint, the first question is what happened, and in this particular fact pattern, and the second question or third is please provide us with a copy of your security risk analysis from several years going back. And that is always the question that makes me the most nervous, because most of the time the client I'm working with doesn't really have one. And I think that's true kind of across the spectrum of small to large organizations. Large organizations may have one, but it's not organized maybe the way OCR would like to see it, or maybe it's all in the head of one or two technical people, which is great maybe from a practical perspective, but from the perspective of showing your work, which is really what this is all about, it's not very helpful. So I guess the first tip I have is actually read the security rule. You'll find the security rule has a lot of requirements, technical, physical, and administrative, and one of them is the security risk assessment, and one of them is the risk assessment management, the risk management plan. So make sure that if you do the security risk assessment, you don't stop. You do the other parts of the security rule. Similarly, don't just read the security rule and do the other parts and skip the risk assessment. It's all part of the same thing. And just to kind of put this for you visually, you can see that security management process is one of many requirements under the security rules. So don't skip one or don't skip this. And in fact, doing the security management process will inform how you do the rest of your security rule compliance program. It's also worth looking at the OCR website. There are several publications. I'll point out a few that are particularly helpful. But there is information out there, and whoever is in charge of the security risk analysis and management program should be familiar with those resources. So just another, I guess, kind of data point for you is of those 52 or so resolution agreements where there were money settlements, at least 20 of them had a specific finding that the organization did not conduct a security risk analysis and or did not follow up on the management of those risks that were identified. So this is really a problem for a lot of people across the industry. So a couple, I already said we're just going to give you building blocks. We're not going to tell you what type of encryption to use or how to set up your firewall. You do need a technical expert to help you figure out what types of protections and vulnerabilities and threats are out there. You don't necessarily have to hire someone outside of your organization. That's a myth. HIPAA doesn't require that you have an independent expert conduct your security risk analysis. And I certainly can say that the security risk analyses I've seen don't necessarily, the complexity and how well they're done doesn't necessarily correspond to whether someone on the outside has done them. So you want to find someone that you trust and has an understanding of what your industry looks like and is also keeping up to date on the security risks and how to mitigate them. The security risk analysis is not something that you can just go buy off the shelf. And similarly, you can't just go buy security rule policies off the shelf and then you're going to have to do it specific to your organization, and then your policies are going to have to be specific to your organization. Security rule analysis is not just a one-time event. You need to do it once, and then you need to revisit it periodically. At least, there's not a prescribed period, but I would say at least semi-annually or annually you revisit it to make sure it's up to date, and then every time you have a new technology that affects electronic PHI. And then a note on certifications. There are several, I guess, accrediting or other bodies or companies out there that say we are HIPAA certified, there's high trust, there's lots of different types of certifications. I'm not going to say which one is good or bad because I honestly don't know enough about the various certifying bodies, but be skeptical of what they are saying they do. There's not any one certifying body that HIPAA has blessed or that OCR has blessed. Unlike hospital situations where they say, the Joint Commission, if you do Joint Commission, then you meet the COPs. That's not the situation with OCR, at least today. Maybe that will happen, but just because someone says they're HIPAA expert and certified doesn't mean they are. And on that point, I will say, if someone's trying to sell you that, I would ask them for an example of an audit or analysis so that you can look at the content and probe whether it whether it meets the basic requirements that we're going to talk about here. All right, so as I mentioned before, this is a two-part process, the security management process. It's the analysis of the risk, what are the risks, and then what are we going to do about the risks. So don't forget about the what are we going to do about them. That's just as important. For people who are visual, this is hopefully a graphic that will help you understand the kind of steps that are required or at least suggested by for going through the risk analysis. Again, I'll note and I'll harp on the fact that it's not just doing it once. You'll see on the side, step 4 is maintaining the assessment. So that's going back through the analysis as you get new technologies and as time goes on, so you can make sure your analysis is up to date so that when you do get the letter, you can confidently send your most current risk assessment to OCR. I can't believe this, but I'm blanking on what NIST stands for. I'm looking, and we're all blanking, and that's fine because NIST is NIST is the government body that recommends technical security standards, and OCR has. Margie, she's Googling it on her phone. Thank you. The National Institute of Standards and Technology. It is under the U.S. Department of Commerce. So this is the most technical body in the government that OCR is going to refer to when it says we want these sorts of standards for your security management program. There is a lot of guidance out there from NIST. It is good guidance. It's not probably able to be followed by many people, including me, but there are some overarching guidance documents that OCR has handpicked and said, we think these are good for conducting your security risk analysis. And I think at the very least, if you're the general counsel or you're the lawyer in charge of the security risk management program, or at least you touch that area, you should at least take a look at this the document I have linked in the second bullet, which is the 800-30 guidance document. That talks you through the major steps for performing security risk analysis. And in fact, harken back to that several times here in the next few slides. So just very basically, what are the steps here for doing a security risk analysis? So make sure you gather the right people to do this. The only person that HIPAA requires you to involve is the security officer. By the way, you should have named someone a security officer if you are a covered entity or a business associate. See a lot of covered entities that only have a privacy officer. Agreed. They can be the same people, but someone should know that there's a security officer and they're in charge of protecting electronic PHI. You don't just want the security officer, you want someone who knows a lot about the various operations and what the business touches and how the business touches PHI and where. You want your technical expert, maybe that's an outside consultant, maybe it's not. And then I wrote note taker, and it seems sort of elementary, but compliance with this part of the rule is actually all about showing your work. And so if you've sat down and had these conversations and actually put in implementations in place, it actually isn't very helpful unless you can show OCR the documentation that you've done so.
And I completely agree with that, and in fact have seen OCR say you didn't do an appropriate risk analysis because you didn't include, for example, your copy machines, even though the entity had done work with their copy machines to ensure that the hard drives were encrypted and they had a plan for getting rid of those when the copiers reached the end of useful life. But because they didn't have it written down in their security risk analysis, that was a finding of fault for OCR.
That's very helpful. Thank you. So show your work. And I would say focus more on the substance than the form. It doesn't have to be fancy. Just get the content. So when are you supposed to do this? Well, hopefully everyone out there has done this, and we're just tweaking at this point. This is actually, security risk analysis and management have been part of the security rule since it became the security rule. Obviously, as Briar discussed, we're probably going to see a focus on that more given the audit findings and what's been happening with the increasing use of malware and threat to electronic PHI. All right, so you've gathered everyone, and now you're actually going to do this thing, and what in the world how are you going to put this together? Right now, so when I talk about how to put this together, this is not, I don't believe that the NIST documents have any sort of specific format requirement or that OCR has prescribed a format. What we're telling you to do is based on our experience in negotiating with OCR in whether someone's risk analysis was good enough. And also this is based on sort of generally the NIST recommendations. You should have, I think, you should put this in some sort of chart form. And we'll show some graphics here, but the whole point of this is to have a list of your assets that have PHI. So this is your asset inventory, all of the places in the organization that have PHI. And so, you know, these are just some of the examples on this slide of places that sort of obviously have PHI. And that's going to be the rows on your chart. And then you're going to have columns along the top that are going to have the basic components of what a risk assessment should have. And so for each asset that has PHI, you're going to have these things. You're going to have what are the threats to it, the likelihood of the events, the magnitude of the impact, the risk level. We're going to talk through how to get here. Security measures you currently have in place, what you need to have in place, and then, again, the really important part about the timeline and plan for implementing those measures you've decided you needed in the future. So really basic here, but this can be made more complex and detailed based on kind of the sophistication and size of your organization. But this would be just kind of an example of having your assets listed in the rows and then your columns of the different components of the assessment. So for desktop computers, you're going to list all of the threats to EPHI on desktop computers, and then go through the likelihood, magnitude. You're going to assign a level of risk, talk about the security measures you have in place, what you need, and then your timeline for doing things in the future. So we're going to go through each column, and this is where the NIST guidance really elaborates, and you can get sort of academic about what is a threat, and what is a threat source, and what is a vulnerability. Won't get too much in the weeds here, but really what the threat column is talking about is what is the possible event that could happen to the PHI? What's the bad thing? So, you may have PHI out, on your local network that it could be hacked into, and so the threat is malware, right, or hacking, IT incident like that. And sometimes people want to group threats into sort of general categories, and that's all fine. It's sort of like what makes sense for organization and for someone who's picking this up and understanding, able to look at it and understand what the risks are and what we're doing about them. These are just some examples of threats. I think that these threats should be on everyone's list. I don't know that these threats are sort of only threats for certain types of covered entities. These are threats that should appear on everyone's list for various types of EPHI. So then we get to these columns: likelihood, how likely is an event to happen? And then the next one is magnitude, and then the level of risk. So again, you can get sort of academic with what NIST says is likelihood, magnitude, and risk. But NIST actually recommends that you assign some sort of score that's very low, low, moderate, high, very high. This isn't formulaic. You're going to be assigning these scores kind of relative to what the likelihood of other events are. And what I recommend to clients is just go through and just try it and try to score them. And then once you've gotten through your list, you can go back and sort of make adjustments based on, what you determined in finishing the list. I like the very low, low, moderate, high, very high categories. It's one way NIST recommends it. I actually read in an article recently that out of the phase 2 audits, there was an insurance agent contractor who was being audited, a business associate was being audited, and an OCR was kind of picking at the specificity of these categories, but we don't have any more guidance other than what NIST has recommended, so I would stick with that. Same with magnitude. You're going to use this range of values. I often get the question, what is magnitude? What's the magnitude of impact? Is it about how harmful to carry on our example, how harmful the the hacking incident is to the PHI, or how harmful is the hacking incident to the business? And actually, OCR has sort of said both. So I think it's a good idea to think about how bad would it be with regard to the individual whose information was affected if one of these threats happened, and also how much would it harm the business, because that's helpful to you just in your general business operation. So I think you can take both of those factors into account. And then the next column is the level of risk, and this is sort of like this is where NIST envisions sort of a formula with a result. So you're supposed to look at the likelihood of the event with the magnitude and come up with a level of risk. And this is the column that will tell you what your priorities are. NIST helpfully uses the same types of categories. So this is matrix, is from the NIST document I mentioned earlier. Tells you, maybe suggests how you might reach a risk level based on what you've scored for likelihood and what you've scored for magnitude. But I guess what I want to say here is I don't think we've seen OCR say that you scored the risk wrong. We've just seen them say you haven't assessed the risk.
Agreed.
And this is all organization specific. So it's really more about doing the exercise and coming up with what's right based on your understanding of your organization, and not getting hung up on whether it might be moderate or high. So just like I said, do the exercise, and again, it's going to be relative. So you want to come up with a place that makes you feel comfortable based on your actual understanding of risk. Security measures in place. We're almost done going through the columns. The security measures in place, make sure you write down what you've actually done, because this is where you should get credit for what you've done. What do you have in place? How have you already addressed risk? And then, well, this is some more information about what you actually need to do. And this is where your technical expert is going to come in. Your expert is going to be able to tell you what the industry does, what's reasonable in terms of the sophistication of your organization, what's reasonable based on how highly you value the information. They're going to be able to tell you about how effective things are. So this is really where your expert comes in. What do we actually need, and what's appropriate? And just because you've done one thing doesn't mean that you shouldn't have layers of security. And that's something we've heard from OCR a lot, is you should have layers of security. Encrypting isn't enough. Maybe you have encrypted laptop and then you have automatic timeouts for screensavers. Think about the things that you can do that are reasonable and appropriate, and don't just stop at one thing if it makes sense to do more. And then this is the key, is to, once you've assessed the risk and decided what you're going to do, you need to actually have a plan for doing them and a timeline. And so you don't have to say January 3rd, 2018 is when we're going to launch encryption on our, all of our laptops. If that's the plan, great. But if it isn't realistic, don't say you're going to do it on January 3rd and then instead do them on July 7th. Be realistic. I think OCR would expect you to take into account what resources you have and the timeline that you might need. And it's better to just say what you're going to do instead of set lofty goals that you can't achieve. So this is just one line item of what you might end up with if you go through this exercise. So the asset we're talking about is laptops. The threat is that the laptop will be stolen. You're probably going to have more threats, right? There isn't just theft that is one thing that can affect, it's just one thing that can affect a laptop. You've scored it, you've assigned a level of risk, you think it's really high because maybe you are a business that uses, there are tons of laptops out there. You've done some things, but you need to do more. And so here's just an example. I think it's totally appropriate to say, we're going to do this in quarter 4. You don't have to have an actual date, but just a plan. And if the plan changes, change the timeline. Once you do the analysis, it's, this is sort of obvious, but a lot of places do analysis and then just put it on the shelf. Make sure you communicate the results to the people that they're going to affect. In fact, the security rule requires a covered entity and a business associate to train the entire workforce on security rule policies and procedures. That doesn't mean that everybody has to have a copy of the risk analysis or that everyone has to go through the same training, but you definitely need to have people trained on the areas of the security rule and the assets that have PHI that they use so that they are educated on what the policies are. And then make sure you give yourself credit and you document and date your training efforts. And then this is the point I've been harping on, maintain your assessment. It's not enough to do this once and then put it on the shelf. You should probably just put a recurring calendar event every January or something for this little group or whoever you've decided is a security group to meet and then you're at least meeting that much to just go over your assessment. You've done a lot of the work up front, and then you review it to make sure it's still current. You should also be doing the assessment every time you get a new piece of equipment or something that touches electronic PHI that's new to the organization. This is just one example of the many where someone has been dinged for not having a security risk analysis. This is actually a low dollar amount for a resolution amount, $150,000. I'd say they got out pretty well.
It might be one of the lowest.
Probably one of the lowest. The reason I like this example is because this is where the covered entity had adopted sample policies and procedures. They may have bought a set or gotten a set from their lawyer or something, but then failed to customize them and definitely failed to do a risk analysis. And so those sample policies didn't really do them a lot of, didn't help them a lot. But that is, I think, a common situation out there.
And so Marguerite and I will talk a little bit, this is Briar, talk a little bit about the recent OCR updates. As an initial matter, note that things are a little bit up in the air at HHS and therefore at OCR. We had Tom Price there as secretary. He resigned. Don Wright was the secretary for 12 days. And now we have Eric Hargan, the new acting secretary. OCR still has the same person that has been there since the beginning of the Trump administration, but we don't have any real clear signals from him about priorities for privacy matters. So with that said, here are a few of the compliance updates.
All right, it's Marguerite Ahmann here. So there's been kind of a flurry of activity from OCR related to the opioid crisis, some natural disasters, and other emergency procedures. So I'm going to cover a few of those. Quite recently, on October 27th, OCR released some new guidance on information sharing and the opioid crisis. So this was released kind of in tandem with President Trump's declaration of a nationwide public health emergency. And OCR said that it sought to clarify some misunderstandings about the sharing of health information with family, friends, and legal representatives within the context of opioid treatment. And OCR's statement was that it was these misunderstandings that were creating kind of an obstacle to proper care and treatment. I think it's kind of our opinion that looking at this guidance alone kind of fails to also take into consideration Part 2 and other restrictions imposed in state laws. So I would caution that you should kind of look at the full picture of the regulatory requirements when you're looking at this guidance. So OCR isn't trying to change any law here, but it does shed light on how OCR is interpreting certain exceptions under HIPAA, specifically relating to obtaining patient consent and authorization, and within the context of opioid abuse and treatment. So the guidance applies to existing exceptions under HIPAA and emphasizes some corresponding situations within the context of opioid abuse in which a health provider would not need to get specific permission from the patient to disclose to family and friends. The first is when a patient is incapacitated or unconscious. In those situations, a provider may disclose, if the provider deems it's in the best interest of the patient, information related directly to the friend or family member's involvement in the patient's healthcare or payment. So a provider would be able to discuss the overdose itself and some related medical information just while that patient is incapacitated, but they wouldn't be able to share other more general information unrelated to the overdose. The second situation that OCR puts forth is a little bit further reaching, and it's situations where a provider is permitted to disclose information to a third party if the provider, in good faith, believes that the disclosure is necessary to prevent or lessen a serious and imminent threat to the health or safety of a person. And the provider must be disclosing to a person who is in a position to be reasonably able to prevent or lessen that threat. So here, OCR uses the example of a physician who determines that the patient poses a threat to him or herself through continued opioid abuse and decides to disclose to family or friends who may be in a position to help. The guidance goes on to state that these are just interpretations of the existing HIPAA provisions, so the other HIPAA provisions still apply. One example is that you still need to give the patient, if the patient has decision-making capacity, you still need to give them an opportunity to agree or object to the disclosure. OCR here notes that this second exception that I listed on the prior slide of being a serious or imminent threat is an exception that does not require the opportunity to agree or object. But it's also important to keep in mind that there may be applicable state laws that are more stringent than HIPAA. You need to treat this just like any other HIPAA analysis where you factor in your state's restrictions. For instance, in Minnesota here, we have just a narrow emergency health records for a medical emergency, and then that term medical emergency is defined specifically under Minnesota law and would be construed only for friends. And then HIPAA also recognizes a patient's personal representative according to state law, as well as other factors, consent to substance abuse treatment, parental rights, the validity of any written directives. These are all things that are established under state law. And the analysis to figure out how those state laws fit into the decision to disclose records along with HIPAA can be incredibly complex. So we always recommend that you ask a privacy officer or your lawyer to make certain that you're making determinations that comply both with HIPAA as well as your state requirements. Finally, the guidance notes that the decision of whether or not a patient has decision-making capacity is not a static and one-time decision. This is something that's likely to change over the course of the patient's treatment. So they may be incapacitated during the actual acute overdose, but when they regain capacity at a later point, they have the ability to direct the healthcare provider to stop making those disclosures, and you have to comply with those requests. So another big asterisk within the guidance is the fact that OCR didn't discuss Part 2. So 42 CFR Part 2 is a set of regulations that pertain to substance use disorder treatment programs and the information that they keep. Briar and I did a webinar back in April, so I'm not going to bore you guys now with too many details on this.
It was really fascinating.
Thank you, Briar. And if you're just drawing a complete blank when it comes to Part 2, you're probably not alone, but we would recommend that you figure out whether and how it applies to your organization. We have anecdotally heard of a few state survey agencies that are now asking for documentation of compliance with Part 2 as part of the surveys. And likely this is because the regulations were just recently updated in January of 2017. Prior to that, they had not been substantively updated since 1987. So it is understandable if you had overlooked those older regulations. Just a quick note then about Part 2 and what it applies to. So it applies to information which would identify a patient as having or having had a substance use disorder that is obtained by a Part 2 program for the purpose of treating, diagnosing, or referring the patient. So this is information held by what the regulations deem a Part 2 program. And a Part 2 program is defined as either an individual or entity that holds itself out as providing and provides substance use disorder treatment, diagnosis, and referral, or an identified unit within a general medical facility that does the same thing, and then also medical personnel in a general medical facility whose primary function is the provision of substance use disorder diagnosis, treatment, or referral. And then it also entities who receive patient records from a Part 2 program. So you sort of need to do this analysis to determine whether you are a Part 2 program or whether you hold on to records that would be subject to this disclosure. And then if these regulations apply, the big kind of hiccup to the OCR guidance is that the general rule regarding medical emergencies is that patient identifying information can be disclosed only to other medical personnel. So this wouldn't include the family, friends, and personal other people involved in the care that the HIPAA guidance talks about.
Just a comment, I think it's near the top of the hour, but I think we're going to keep going. We still have over 150 people or so on, so we're going to plow on through.
All right. Okay, so moving on, another kind of flurry of guidance came from OCR as the result of some recent natural disasters. I feel like the tone in my voice was too happy when I was talking about natural disasters. But so OCR and HHS is clear in stating that the privacy rule as a whole remains intact even in cases of natural disaster. There are just certain non-compliance provisions that OCR agrees to waive any sanctions that could result from non-compliance with those provisions. So these include the requirement to obtain a patient's consent to speak with family and friends involved in the patient's care, the requirement to honor a patient's request to opt out of the facility directory, the requirement to distribute the notice of privacy practices, patient's right to request privacy restrictions, and then also the patient's right to request confidential communication. And saying that these are very limited situations where both the President has declared an emergency or disaster and the Secretary of HHS has declared a public health emergency. They're going to waive these sanctions, but just for a very limited period of time. So this the time period is further limited with respect to hospitals who have instituted a disaster protocol, and it only lasts for a period of up to 72 hours after the hospital has implemented the protocol. So these are very limited, but we have seen a set of them come from OCR fairly recently. Prior to 2017, we hadn't seen one posted on OCR's website, at least since Hurricane Katrina in 2005. But OCR now has published 4 from this year alone. All right, the final clarification I'm going to cover is one that OCR published in response to the Las Vegas mass shooting. Again, this is just a clarification. There was no new law, but OCR wanted to. It seems like my mic is maybe cutting out, so hold on just one second. Sorry, folks. Thanks for hanging in there. Let me try this one. All right. So this was just OCR to understand that they are allowed to share and as necessary to identify, locate, and share the general in the event of situations such as mass shooting. All right, I think that is going to turn it over to Dr.
And I'm just going to, there has been a little on medical device information sharing. The FDA produces guidance, and in that they specifically say it does not affect HIPAA. So if you are a device manufacturer and you are trying to figure out if you can share information with patients upon patient request, you might check again with the privacy officer or your lawyer about that, just to make sure you've got all your bases covered. The last guidance that I'm going to talk about is not actually new. The OCR published guidance in 2016, but we still get a lot of questions and there's still a lot of confusion about it. I'm not going to go into great detail because of our timing situation, but we do have pretty clear information on slides that you can look at. Keep in mind, generally patients have a right to get access to their own PHI. That includes not just their medical records, but billing records and any other records that the covered entity might have that relates to them. Personal representatives can get PHI when they are acting as the personal representative. Individuals can request that their information go to a different person that is designated by that individual. So I could request for information to go to my spouse or to my lawyer, and that counts as me accessing my own information. You need to provide information in the form and format requested, and you provide it in the manner requested. And so there's some notes there about arranging a time for pickup. You're not required to accommodate unacceptable levels of risk, so you don't have to allow somebody to insert their mobile drive into your system. You can't require somebody to come and pick up copies of their information. You have to send that to them if that's what they want. Charging fees for copies is a big problem. You can charge only a reasonable cost-based fee. Can include only the cost of labor, copying, supplies for creating, and postage if you're mailing it, as well as the labor if you're doing a summary or an explanation of the PHI. This is not, copies of medical records are not supposed to be a revenue stream for your organization, and you have to inform the individuals in advance of the approximate fee. Note that the in advance thing is not found in the privacy rule, but OCR believes that failing to inform people of the fee would be a barrier to access and therefore a big problem. So they also say you should post on your website or otherwise make available to individuals an approximate fee schedule for regular types of access requests. This is also not in the rule and is, I don't know of any covered entities that are doing this right now. I'm sure there are some out there, those things getting the ones on their HIPAA audits. But it's something you could consider. Again, you've got three options: actual cost, average cost, flat fee, $650. The flat fee might be something that a lot of organizations are considering right now because they do get confused on that. So again, feel free to review those slides and email me questions if you have them, and I can certainly answer those as freebies since I didn't have a chance to get them in more detail. We'll also talk a little bit about some privacy officer woes, and I think Katie's going to lead us off on that.
All right, so this is actually sort of an FAQ little section that we'll plow through, and then we'll add some of the questions that we've received during the presentation. So a common question we get from privacy officers is what do we have to do about training? How often? What sort of form do we have to train vendors? And contrary to popular belief, the privacy rule does not actually, neither the privacy rule nor the security rule, which also has a training component, says that anything about the frequency of training, except that you must train. So it has to happen once at least. A lot of people think it has to be annually. That's not a bad rule of thumb. You should do it periodically, and you should do it based on what you think your workforce needs. And just because you train in a general session the first time when someone, and also when someone is hired, you should do it when they're hired, or maybe you do it sort of as the general session once a year. Just because you do a sort of general training doesn't mean that you can't do spot training and topic training as needed. And in fact, you should do those things to supplement based on what people's needs and concerns and questions are. So I think it's really about having a training program that gets everyone upon hire, but then thinks about thoughtfully about how often people need to be trained thereafter and follows the plan for training. Again, it doesn't have to be, a webinar. It doesn't have to be face-to-face. Those are good ways to capture things initially, but maybe you do email blasts, maybe you do newsletters, maybe you do kind of table tents to supplement people's knowledge, that's all good, and you should definitely write down when you do all of those things because that counts. Do you have to train vendors? So you can get into a long discussion about that. When I say vendors, I'm really talking about your business associate. The business associate has a separate obligation, independent of your contract, to train a security rule. They are it's not technically required. Steps to take. You may also want of the vendor's training. Again, you don't have to do that under the regulation, but if you have reason trying to assess the program, that would be a great question to ask as evidence of their workforce training.
Just a couple words on breaches. A breach is any access, acquisition, use, or disclosure of PHI in a manner that also compromises security of PHI. It does require an analysis to figure out if something is just a HIPAA problem or is really a breach. There's a 4-factor test to look at. That's something that legal counsel. You do have to report that happens if you determine that it is an actual breach. Within 60 days, you have to notify the individual. If it's fewer than 500 people, that's great, and you don't have to do any media notification. You only have to notify the government on a yearly basis, 60 days after the end of the calendar year. If it's more than 500 people, within 60 days, you also have to notify the media and the government. If you've never reported a breach of yours, consider contacting legal counsel about options for how to notify OCR. I know that there are entities out there that haven't, and my concern is if they get investigated for something else, that will be something that OCR finds as a problem. And just business associate agreements are a constant woe of privacy officers and everybody else. Just most importantly, do you have them? Make sure you've got them with every vendor who's accessing your PHI. Make sure you can track them. Make sure you've updated them with the necessary security rule language, which was several years ago, but we know lots of entities that don't have that. And then do you have contact information in the business associate agreement? So email for notifications to your business associate and back. It's not required by the rule, but OCR has now says they expect to see that. And I think that's all we have for the specific content, and we'll try and get to a few of your questions right now. One is, someone has asked, do you know how soon entities hear back from OCR on their audits? The understanding was that OCR would respond within 90 days. And I would say, I know that there are definitely some entities that have received their audit reports back from OCR, but would not be at all surprised if it took quite a bit longer than 90 days for many covered entities, because OCR is sort of behind on their investigations in general, and I think the audit stuff may have been pushed back a little bit into 2017 and now possibly into 2018.
One question we had on risk analysis and risk management, those kind of two-part sections of the security rule that I highlighted. The question was, may you have a separate document for the risk management plan from the risk analysis document, or is filling in the dates of the risk management plan to the risk analysis enough? I don't think I've seen any guidance that gets into specifics on how many documents these things are in. I think it's really about the content. So if your overall analysis incorporates the plan, I guess I'd focus on that over how many documents and how you, organize it. Ultimately, it should make sense for someone to pick up and read, and also for people in your organization to follow.
I have one here about if information is faxed or mailed to an insurance company, does this count as a release of PHI that should be included in the list of disclosures? And I think that is referring to the accounting of disclosures that each covered entity is supposed to have. And no, this is assuming that it's mailed to an insurance company that you are submitting claims to. That would be a payment disclosure, and that would not be part of your note or part of your accounting of disclosures. And I think that's probably all we have time for. We'll get to any additional questions. We can respond via email if we know who they're.
Yeah, so just on that point, make sure you email us your questions, I think this is good, show up anonymously unless you give us a name. So please do reach out to us separately if you do have a question.
And actually, I do have one anonymous one. If a covered entity notifies patients in advance that all records requests include a $25 processing fee, is that considered an unreasonable cost? For sure is. You're not allowed to charge any processing fee at all. Not even $1. So if you have a labor that you've specifically determined it costs us this much to process each request, that can be part of your charge, but I would not ever call it a processing fee, and $25 is almost certainly going to be on the high side for OCR.
So we'll wrap up there. I do want to say before we sign off, make sure you fill out your surveys. They are actually anonymous too. We don't know who says what unless you give us your name. So hopefully you're very candid knowing that we don't know who you are. But we're happy to take feedback. We always want to know who you are. Also, there will be some employment law topic webinars that we are going to send out to this list. Those webinars will be to our health law webinars. They're going to they won't be state specific, they'll be federal law. And those are going to be based on talking about accommodation challenges, problematic employee behaviors, protecting your company's reputation, the digital age. That webinar series will happen in December, and so you should see an invite for those webinars coming from us. Thank you. If you like this topic, if you have more HIPAA questions, if you want us to do another HIPAA kind of grab bag webinar, please let us know. We always want to hear your feedback. Thank you and have a great day.